2, 1, 0. Good afternoon, everyone. Thank you for joining us again in our weekly media briefing with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government, and joining us today is Dr. Keisha Davis, the county's health officer, as well as Dr. James Bridgers, Director of the Department of Health and Human Services. Also from HHS, Mr. Sean O'Donnell, who is Program Administrator, Public Health, Emergency Preparedness, and Response. We do have a very special guest this morning, who is U.S. Representative for Maryland 8th Congressional District, Jamie Raskin. Thank you, everybody, for joining us. We'll get started, Mr. County Executive and members of the media. For the Q&A portion of this presentation, please raise your hand. Mr. County Executive.
Thank you, and thank everybody for joining me again this week, and I especially want to thank our Congressman Jamie Raskin for being here. Today I'm talking to you from the Bethesda Chevy Chase Regional Services Center. I'm coming from a bill signing for the Safe Streets Act. Among other things, it will ban the practice of turning right on red at a red light at busy intersections. This will bolster our Vision Zero goals to eliminate road deaths by 2030. After this briefing, I'll be joining business leaders in Bethesda who've been able to raise $500,000 over the last 5 years to help out our community on hunger issues. The Business Leaders Fighting Hunger group is small, but their impact has been felt in several different ways as they work to make a difference in our community. And I want to applaud them and their work for Montgomery County. On a less positive note, the federal government is facing an imminent shutdown later this week, which certainly will affect people across the country and world, but also here in Montgomery County, where so many federal employees live and where so many programs are being implemented. Let's be clear, this is an impasse Republicans are responsible for. And the word is going out to federal agencies to prepare for the worst because negotiations are not close to closing this issue at this point. Hopefully that's one of the things we'll hear more from Congressman Raskin about. The worst government shutdown came just after I took office in late 2018, early 2019, when 38% of the federal workforce was out of work, and for a little more than a month. I remember the stress it put on our residents, businesses, and even our own government operations. And some federal workers are forced to work without pay, with uncertainty over whether they'll eventually be paid. That must be decided by Congress after the fact. Others are furloughed and may not get paid at all, and also to be decided by Congress. Then there are contractors and subcontractors and all of the employees who face even more uncertainty. The fight over the shutdown stems from a Republican dogged effort to destroy important federal programs that make a meaningful difference. And I want to quote the Agriculture Secretary, who told the New York Times, if we have a shutdown, WIC gets shut down. WIC stands for Women, Infants, and Children, the people who benefit from the government program responsible for providing healthy food for struggling single parents and their families. In 2021, an average of more than 16,000 children and nearly 13,000 women in Montgomery County participated in WIC. Based on census estimates, there are approximately 65,000 children under the age of 6 who are actually eligible to participate in WIC. In previous shutdowns, federal research labs had to shutter their important work until cash flow is turned on again, which could have impact on some companies that have made Montgomery County one of the top life sciences hubs in the nation. The Republicans, unbelievably, are also proposing to cut Title I funding by 82%. What does that mean for Montgomery County? Our school system currently receives $51 million in Title I, which goes to 35 of our schools serving the most impacted students and communities. I will add, mostly people of color. This funds about 300 teachers and staff in Title I schools, gives full-day Head Start programs, and given the children who benefit from this funding, their attack on this is nothing less than a racist, cynical maneuver to continue the inequality that is the legacy of slavery, which they would like to pretend either didn't exist or was a perfectly fine thing, except for maybe roughness around the edges. And the 82% in reduction would cut MCPS allocation by $42 million to just $9 million. It would reduce the critical importance of Title I schools, the critical supports our Title I schools receive, including Title I summer programming, academic interventions, social emotional support, and other direct services to our students. This is absurd, mean-spirited, and bad for the nation, and it's also a reminder of why they work so hard to erase American history so that nobody understands how we got there and what we need to do to fix the problems that have been created here. In Montgomery County, we're grateful for all the efforts of our congressional delegation to bring some sense to Congress, especially including Congressman Jamie Raskin, who's joining us today. We're very fortunate to have Jamie, who is recognized nationally as a champion of democracy, a constitutional scholar, and an excellent legislator. He's also a ranking member of the House Oversight Committee, and he and his staff understand the worries of our residents facing possible shutdown, and they're ready to help wherever possible, as they have always done so well. So my team's worked well with yours, Congressman Raskin, and we thank you for that, and I'm proud to have you as my guest this week. So the show is yours now.
Mark, it's a delight to be with you and with all of your excellent colleagues in the county government who've assembled, and we benefit immensely from the hard work of your staff, and we love working with you guys, even in tough times like this. Let me quickly just state something about where we are with respect to the shutdown, and then what the practical implications are if it in fact happens. With my Democratic colleagues, we've been working overtime to try to avert a shutdown, which we know from our own personal and collective experience has been a disaster for tens of thousands of people who are my constituents, and hundreds of thousands of people throughout Maryland and Virginia and DC, and millions of people across the country. I reintroduced with my colleague Don Beyer from Virginia the End Shutdowns Act, which would prevent shutdowns going forward categorically by initially instigating an automatic continuing resolution on October 1st if Congress has not met its constitutional responsibilities by passing a budget. In other words, if you get a faction like the MAGA faction, which tries to throw a monkey wrench into the budget process and succeeds in doing so, on October 1st, there would be an automatic continuing resolution that would keep the government funded using the same budget allocations that were in the prior year's budget. We also have been putting pressure on Speaker McCarthy, and we wrote a long letter to Speaker McCarthy telling him to continue to abide by the agreement we made in May to avoid just this possibility of a political effort to wreck this essential responsibility of government, which is just passing a budget. All we're asking Speaker McCarthy to do is to abide by the agreement that we had. And that means that we could overwhelmingly pass a budget because the Democrats would stand by it. The problem is that he's being threatened by the MAGA caucus, that if he goes forward with the agreement that we had entered into back in May, they would then try to vacate the chair, which is just the parliamentary speak for topple the speaker. They would essentially vote to overthrow his speakership and to end it if he does that. And I don't know whether or not they would follow through on it. I don't know whether or not they've got another candidate. But in any event, the Democrats stand prepared to vote with Speaker McCarthy in continuing the budget agreement that we made back in May, anticipating just this crossroads where they would try to do this to us again. Having said all of that, we are fighting for the best, but we are preparing for the worst, and we want to make sure everybody's got the information that they need to know. The first thing is that federal workers who live in Montgomery County, and I've got 56,000 active federal employees in the district, and tens of thousands more retirees, and tens of thousands more whose livelihoods are intertwined with the federal government as federal contractors and people who work in associated industries. All of those people should definitely check out the OMB website, the Office of Management Budget website, which has prepared a resource consolidating different federal agency contingency plans across the federal government. As you know, there is a federal statutory requirement that each agency and department create a list of both accepted and not accepted employees in the event of a government shutdown and a furlough. If you're not accepted, that means the furlough applies to you. That means you are not going to work. Although because of legislation that I introduced with Don Beyer and Jerry Conley and the Maryland delegation during the last shutdown, everybody will get paid for the paychecks that they miss, every federal employee. That's not true of contractors, but it's true of federal employees. But Mark, you would not be surprised, given the devoted constituents we have, how many people are very stressed out about not going to work, even though they're going to be paid. They want to be able to do their jobs, and they understand how essential and critical their work is. And I've seen that also in my staff, because I have to delineate who's an essential employee and who's not. And all of my staff are essential employees. And even the interns have told me they want to come in. And we're waiting for an opinion from the House of Representatives about whether we can continue to have the interns who are paid a minimal amount, but they're paid something. And we do consider their work essential. Our whole team is essential to meet the demands of the constituency. And I've got more than 800,000 people in the 8th District who we respond to. So in terms of my office, we're open for business. And so we are going to be there to deal with people's questions and people's concerns and problems. And there are always a ton of unforeseen problems that come up, as much as we try to plan for the basics. Now, let me go over what some of those basics are. Will I get my Social Security, my SSI, my Medicare, my Medicaid, my VA benefits? The answer to that is yes. Those benefits, your Social Security check, your Medicare, Medicaid payment checks, those will still be coming. However, in all of those departments, there are things that are done beyond the issuance of standard benefits, and those could be dramatically affected. For example, if you take the VA, it's not just getting people VA benefits. There's also divisions that deal with education and job training and support for veteran-owned businesses, which is very important to us in Montgomery County because of the special programs we have related to that. There are even programs that directly assist homeless veterans. All of those could be affected, and almost certainly will be, again, depending on the classification of which employees are accepted and therefore considered essential, and which are not accepted and therefore will be furloughed. That is something that is going to be done on a department by department, program by program basis. And so, federal employees should check out both the website of their own department or their own, their own bosses, or they should check the OMB, the Office of Management Budget website. Do federal employees get paychecks during a shutdown? No, they will not, but they will get paid when it's all over for the pay that's been missed because of this legislation that I mentioned to you before that we got passed and we fought for during the last shutdown. Can federal employees who are furloughed apply for unemployment benefits? They may be eligible for unemployment compensation for federal employees. Maryland has made that possible. OPM worked with Maryland to allow furloughed employees to file for unemployment without having to go out and prove that they're looking for other work. But then once they get paid back for the paychecks they missed, they would have to repay the state for the money that's essentially been floated to them. Military and federal retirees will continue to receive their retirement benefits. But the processing of new applications or other requested changes will be delayed, which I found out because I had a couple of constituents who were just about to retire in the middle of this, and their new retirement status may be affected by the shutdown and workers being furloughed. Air traffic controllers, TSA officers, Customs and Border Protection agents will remain on the job without pay. If they don't, if some of them don't report to work, which is what we saw during the last Republican shutdown, there may be significant delays and longer wait times across the country. There's nothing that can be done about that, but there are simply some workers who say they can't afford to work without pay, even for one pay period. Will air travel be affected? Well, all of those people I just mentioned, the air traffic controllers, the TSA officers, and so on, will remain on the job without pay. Again, some people might not show up, so there could be delays, but if all goes well and we get through this thing quickly enough, we hope there will be no major disruptions. FEMA staff is still going to be working, accepted, and will still respond to emergencies. One area where there will be a dramatic impact, Mark, is in the SNAP program for women, infants, and children. I think you mentioned this. It will quickly run out of funding, and it will be unable to provide food for children and parents in need. And in case of a prolonged shutdown, SNAP benefits will almost certainly be affected. And we've already, had some, very anxious people concerned about what this is going to mean if this goes on for a long time. Now, all of it might make you ask the question, why exactly would we shut down the government of the United States, something that no foreign enemy of the United States has ever been able to do? Like, why would the Congress be put in a position where we're shutting down our own government? And, this is a matter of a lot of speculation among members, as we were here last night till I think 1 or 1:30 in the morning. Some people think that there's a faction in Congress which is now just addicted to chaos and crisis, and a shutdown obviously continues the kind of chaos and pandemonium that they've become addicted to. It might be more specific than that, Mark, and I'm going to be talking about this week. Donald Trump has sent out on Truth Social, his social media platform, numerous statements saying that there's a big deadline coming at the end of September. This is the last chance to stop the, quote, political prosecutions of Donald Trump. He believes that if we shut the entire government of the United States down, it will halt his criminal prosecutions in federal court in Florida and in Washington, D.C. And Matt Gaetz, who's been one of the leading exponents for Donald Trump in the Republican conference, has echoed that, saying that the boss, that Donald Trump has said, no continuing resolution, hold the line, which I found particularly irksome, given that hold the line was what our Capitol officers were chanting and yelling on January the 6th when they were attacked by insurrectionists. But the analogy is not a totally casual one there, because this really continues the idea of trying to shut down the government and violate the American constitutional order. So Donald Trump believes that it might shut down the federal criminal prosecutions. I don't agree with that. In the last shutdown, the federal courts were interrupted in terms of a lot of civil litigation and had to postpone that. But most criminal cases advanced. He thinks that if he creates enough chaos in the country, they won't be able to go forward, and he'll be able to make it to the election without having to face a jury of his peers. I don't know whether or not he's right, but I do know that that determination, that decision to try to shut down the government of the United States and to spread mass pain and mass confusion and tremendous budgetary losses is a moral scandal and a shame. And none of us in Congress should be associated with that. And yet there is a faction that is willing to do whatever Donald Trump wants. And unfortunately, they seem to be driving the train of the majority at this point, which is why we do have to prepare for the worst. I yield back to you, Mark, and I'm open for any questions before I've got to go in 5 minutes.
Thank you, Congressman. Mr. County Executive, we're going to open it up now for the Q&A portion of this presentation. Members of the media, questions regarding this topic for the County Executive and or the Congressman, please raise your hand. Tom Fitzgerald, Fox 5 DC, you've had your hand up for quite a bit. Related to this topic?
Hi there, how are you? Can you hear me?
Yes, we can.
Okay, great. Congressman, County Executive, good to see you. Congressman, could you quantify for us, it's not just federal employees and contractors that are affected by shutdown. There's a tremendous impact of local business, you know, restaurants, shopping centers near NIST, all kinds of businesses that depend on federal workers. Have you been able to quantify what the impact of local businesses are from a shutdown?
Well, Tom, it's good to see you, and thank you very much for the question. I don't have the precise numbers on that, and it's interesting you ask, because I asked someone from the Chamber of Commerce about that yesterday, and I'm hoping that we can get back some estimates based on prior shutdowns. But we know that the damage is in certainly the tens, if not the hundreds of millions, to local businesses and restaurants and so on that are affected by the government shutdown. And a lot of them, of course, are still struggling to recover from where they were based on the COVID-19 disruption. And, you know, this could be a seriously lethal blow to a lot of our local businesses if, you know, Speaker McCarthy allows this to go on even for a period of 3 or 4 weeks.
Thank you.
But I will try to get those specific numbers to you, Tom, and I'm here with some people on my communication staff, and we'll try to nail that down today and get you some numbers.
Thank you.
Thank you, Tom. Kate Ryan, WTOP. Good morning.
Good morning. Thank you very much. Just following up on the impacts, we've talked about 2 programs, WIC and SNAP, how they would be directly affected. Do I also understand that programs like Head Start and other pre-K programs, daycare, will be affected by this? Can you, and again, do we have more numbers on countywide? I know Representative Raskin, you're talking about within your district, but do we have countywide numbers as well?
Well, every federal program is going to be affected one way or another. And depending on the length of the shutdown, if God forbid we have one, it could become extremely serious. And certainly it is that with the WIC program. EPA hazardous waste cleanup is going to be affected immediately. I talked to some people from NIH yesterday. NIH will be unable to take any new patients in clinical trials. Now, as a recent cancer patient, as you guys know, that caught my attention. I mean, those clinical trials are a matter of life and death for a lot of people from our area and a lot of people who come to our area seeking to participate in an NIH medical clinical trial. They are going to have to stop taking any new participants. So, Kate, thank you for the question, because you know, we're going to have to do an inventory of what the impact is going to be on every single federal program and agency. And as you can tell from these details, it's going to be dramatic.
Thank you very much.
Thank you, Kate. Rafael Sanchez Cruz, you lowered your hand. You don't have question?
It was the same as Kate, so I'll
Okay.
leave the time. We know we're limited for time, so we'll keep going.
Thank you. Thank you very much. Heather Curtis, WMAL Radio. Good afternoon, almost. Heather? Okay, Dario Lopez Capera, Telemundo 44.
Thank you, Lorna. A couple of questions. What is the plan to help people who have food stamps, not contractors, such as cleaners? And in terms of taxpayers, how much it will cost this shutdown to the county?
Well, let me just take a shot at the first one, and then Mark, I'll turn it over to you in terms of the county stuff. But I'm glad that you raised that. You know, I talked yesterday to some people who work in the cafeteria at one of the federal agencies. Those people, whether they're public employees or more likely they're employed privately, are going to be affected directly. Lots of federal contractors are going to be affected directly and immediately. We haven't quite gotten there in terms of the conversation because we're still trying to avert the whole catastrophe. But I will tell you from our experience in January of 2019, the Democrats fought very strongly to see to it that the workers in federal contractors at that level would be compensated and would be made whole. You know, there's lots of people who can't make it through one pay period, much less 2 or more pay periods without getting any money. So that's very much on our minds and on the minds of the local delegation here. So we're happy to follow up with you, Rafael, to talk about that if and when a shutdown happens.
And for our part, we're hoping that people are able to take advantage of the extension of unemployment benefits with the idea they have to be paid back. I just sort of remind everybody, because you know we've dealt with unemployment benefits before, they do not match your previous paycheck. So it is a pretty small sum, which a lot of people will receive to replace, you know, paychecks that are no doubt larger than what the unemployment benefit is. We're hoping this is short and brief. Last time the county was involved in organizing, you know, food giveaways like we did for COVID. So it's a sad state of affairs. We obviously don't have the resources to suddenly absorb replacing people's paychecks. So this is going to be hard for a lot of people.
Well, I've got up in my office, Mark, a poster, free hot meals, chefs for feds from that last round. And,
yeah,
you know, there's going to be a lot of volunteer and community efforts. That was our friend, Chef Jose Andres, who put that together, getting local restaurateurs and community groups to work together to set up, you know, lunches and dinners for people to make people through, to, you know, help people get through the crisis. And obviously it's a different level of crisis for different people depending on their situation, but it is a general crisis for our community.
Congressman Rask and Heather Curtis from Omal Radio is having issues with the audio, but here's her question. Where the End Shutdowns Act now stands and how optimistic is it that it will pass at some point, even if not in time to avert this shutdown?
I'm sorry, what was the beginning of the question?
Where the End Shutdowns Act now stand and how optimistic?
Well, I am optimistic, just like we were able to pass during the last shutdown, the provision which says that the federal workers are made whole when it's all over. I'm optimistic that nobody's going to want to see this happen again, and we need an automatic trigger. So Congressman Beyer and I are going to be pushing this very passionately during this crisis. And, you know, as I said at the beginning, we are still working to try to avert the whole thing. Yesterday, the Senate overwhelmingly passed a clean continuing resolution to allow the government to stay open on the prior budgetary terms, adding only aid for Ukraine, which is an emergency, and aid for areas of America affected recently by disasters, which is also an emergency. That was done on an overwhelmingly bipartisan basis in the Senate. So we've got the Senate Republicans and the Senate Democrats and the House Democrats and the President of the United States all agreeing to keep the government open. And our problem is within the House majority, the House Republicans, and one small faction of that, which is threatening to derail the whole thing in order to shut the government down. And as I said at the beginning, I think that's all because of the determination of one guy, one former president, who thinks that's going to benefit him in court. That is not the way that the oldest modern democracy on earth should be operating, and we should be able to rise above that at this point.
Thank you, Heather. Darcy Spencer, NBC4.
Good morning. Just a quick clarification. Congressman Raskin mentioned 56,000 federal government workers in his district, but just trying to get a hold of, do we know how many federal government workers live in all of Montgomery County? And what are some of the largest facilities where they would be working?
So, well, what I've got from the most recent data is the total federal civilian employment in Maryland is 138,942. There in the country, there are 1.3 million active duty service members. In Maryland, we have 29,500 active duty service members. Let's see, 123,000 WIC recipients in Maryland. That's across the whole state. So if there are other specific statistics you're interested in, we can definitely try to find them for you. Would
Mr. Elrich happen to know, or his people?
I don't know the total number right now.
Okay.
Well, we can try to get you more refined statistics for, specific numbers you're looking for. But suffice it to say, we've got huge numbers of people working at NIH, working at NIMH, working at FDA, working at NOAA, working at the Federal Election Commission. I mean, we've got federal employees all over, and we've got tons of people who live in Montgomery County but go to work in Washington, D.C. at, the Department of Agriculture, the Department of Labor, the Department of Commerce, go to Virginia to work at the Pentagon, and so on. So we have a very strong and cohesive regional delegation of people who understand what this means in the lives of federal workers, and of course, everybody who's served by federal programs.
Thank you.
Thank you, Darcy. Suzanne Pollack, Montgomery Community Media. Good afternoon.
Good afternoon. Thanks. I wanted to find out if any county officials are already meeting have we set up plans? Would there be food, special food? I know you did that a lot during the last one, but has there been already plans set in place? Or are you waiting to find out just how, only if it goes fairly long, that you need to do this?
I mean, I know that people are talking about what our response is going to have to be. I'm not interested in waiting a long time to see how this drags out, because people could pretty much start feeling the pain early. I mean, I think Jamie made a point. There is a wide differential in federal pay. So there's some people who, at the pay levels, they could probably absorb, a temporary setback, knowing they're going to get paid back. Their families, even at federal employee level, who live paycheck to paycheck, whether it's rent, food, medical care, they cannot sustain themselves without paychecks. So we may see effects very early for some portion of the federal workforce and a little bit later for other portions of the federal workforce. So we're concerned. Hopefully we'll be able to rally the same people who rallied before to put this in place.
Thank you.
Thank you, Suzanne. Members of the media, no more questions regarding this topic. Rafael Sanchez Cruz, WUSA 9.
Yeah, thank you, Lorna. I wanted to elaborate, give you the chance, County Executive, to elaborate more on the impact of Head Start. I know we talked about it roughly, but what does that look like? Are we talking about immediate closures? Are we talking about, as the days go on, we would see this impact on some of these centers? The federal registry shows that 6 of them are located in Montgomery County. They receive federal funding.
But Mark, forgive me, but I've got to go to meeting. But thank you all, and I will definitely be back in touch. And please keep your fingers crossed that we can avoid this.
Thank
Thank you
you.
very much,
Thanks, everybody.
Congressman. So to answer your question, we have to analyze what the cash flow is. I mean, it's, we don't get a weekly check for every, government center or every program we operate in Montgomery County. So we're going to have to analyze, which programs have how much funding in the bank and how long that funding will carry them. And that's going to be that'll be our limiter to figure out how long we can be carried by the shutdown, or how long we can be carried by the funding that exists. I don't know if Dr. Bridges wants to add anything to this, or Dr. Davis, but we're waiting like everybody else.
Sure. Thank you, Mr. County Executive. Just a couple of notes to add. Dr. Davis and I are speaking to the respective secretaries under Health, Dr. Herrera Scott, and under Human Services, Dr. Lopez. We have a meeting. Our staff have meetings with those respective agencies on Friday. And not only look at some of the challenges that we may face, but what's available. We know that there may be some immediate impacts, but we're looking at if a shutdown goes deeper into November, how does that look? Because that's when we start to see those greatest impacts based on historical closures. Just want to go back to Suzanne's question, I believe, about ongoing food distribution. We have our food hubs, working with our hubs internally at the Department of Health and Human Services, and also working with Ms. Bruskin with our Office of Food Systems Resiliency, I should say. So we're looking at all of those strategies that are in place now that we need to either publish additional information, look at the frequency, publish a schedule, so that folks will have that information readily available. And as we develop those communication items, we will work very diligently with our public information office so that those those distribution points are known to the community.
Thank you, Rafael. Thank you, Dr. Bridgers. Mary Anderson, your hand is up. You have an additional comment?
I just wanted, Suzanne and others, I can contact you after the media briefing and give you the website where our food distribution events are listed, and their hours and that type of thing. So shoot me an email or a text when the briefing is over, and I'll give that information to you.
And I have another question here on the chat from Heather Curtis for you, Mr. County Executive, about unemployment. People often don't get unemployment right away. Would people even be able to get checks soon enough to help if they miss their first paycheck?
I would be surprised. We know that, during COVID, it took a while for people to be able to get paychecks. I don't know how long the process is now, and I don't know how long the process will be if some of the employees who actually would be administering this at the federal level aren't there to administer it. So your guess is as good as mine.
And Kate Ryan, your hand's up again. Do you have any other questions regarding this topic?
I do, a brief one here, and this goes to Drs. Bridgers and Dr. Davis. Would any of this have impacts on your ability to both track COVID, administer some of the clinics that the county does? Are there health effects that we're looking at in terms of administering public health?
So I will ask Dr. Davis and Mr. O'Donnell to weigh in immediately. We have those systems in place, and we're looking at the vaccination schedule now, so they aren't immediately tied to any federal funding. These are supported through county dollars, but Mr. O'Donnell, please provide Kate with any additional information regarding her question. Thank you.
I suppose this is probably a good time for commercialization of the COVID vaccine process. Most of the vaccine is going directly from the manufacturers out to commercial entities, the pharmacies, the medical providers. And of course, there's the federally supported Bridge Access Program, which is getting free vaccine out to many of those providers as well as the local health departments so that we can help vaccinate those either without insurance or with insurance that doesn't cover immunizations. So we don't anticipate any, the stoppage impacting that. We've already, we'll get to this in our COVID briefing. We've already received some of the vaccine from the manufacturers for the bridge program. So I don't at this point anticipate that impacting our ability to respond that way. A lot of our surveillance that we share with you is locally done or done in conjunction with our state partners. So again, we should be okay as far as most of that.
Thank you very much. Dr. Davis, same?
No, nothing additional. Sean captured all of it.
Thank you both.
Thank you, Kate. Rafael Sanchez Cruz, your hand's still up. Do you have follow-up questions or can we? No, okay, you're done. Mr. County Executive, we can move forward now with a public health update and other topics. Thank you, everybody.
Thank you. And thank Congressman Raskin for joining us this morning. It's always very useful to hear what he has to say. And he's in the middle of this fight. I want to turn now to another issue, and this involves, public health, and that's the cost of prescription drugs, which continues to be a burden to many families here in Montgomery County and across the nation. And as the drug companies continue to push for higher prices, in the last 2 years, we've actually seen record inflation in prices for more than 1,200 drugs whose prices increased above inflation. These are drugs that have already been developed, already been on the market. They don't have new R&D costs, and yet they continue to go up. And I know when I was at the event with Vinnie DeMarco yesterday, and Vinnie's been a champion of healthcare and healthcare reform and single payer and particularly drug company reform. He talked about an incident where a congressman asked one of the manufacturers why they were raising the price on an already established drug as much as they were raising it. And the guy's very simple answer was, because I can. And that gets to the heart of the problem. Just because you can do something doesn't mean you should do it. And it's an inordinate amount of power that's in the hands of drug companies. And I know for sure that nobody on this call, nobody listening, and nobody this message will go out to sit in positions where they can simply say, I think I want more money for what I'm doing, and so I'm going to demand more money. Our employees don't do that. Nobody's employees do that. And the idea that we've got a certain group of elites in this country that have no obligation or commitment to society is a little bit alarming. I mean, they can make plenty of money. They'll be plenty rich. They do not need to make it impossible for people to get the medications they need. We know that 1/3 of Marylanders report not taking their medication as prescribed due to cost. And that's why I've been working with advocates to put measures in place to help bring down the cost of these essential medicines. Yesterday, I joined Maryland State Senator Ben Cramer, Delegate Bonnie Collison, Charlotte Crutchfield, Vaughn Stewart, all at the Leisure World event for an update on the Prescription Drug Affordability Board. I supported the creation of the board, and Maryland is ahead of the curve nationally on implementing this new model of regulation. But despite our success of creating the board, we still have more work to do to give it more power and the ability to better regulate the market in our state. And the more other states see how our efforts are working, the more they're inspired to create their own boards and join the fight. As part of this effort, the Maryland Healthcare for All Coalition and I heard stories from people fighting for their lives and spending their life savings on medicines to survive. Just yesterday, residents shared stories about drug price increases and healthcare companies refusing to cover certain drugs. We've got these pharmacy benefit managers that have inserted themselves in the supply chain that actually, act as what the Republicans used to refer to as the death panels, people who deny access to people for the drugs because they don't think they're worth the price, or people who, raise the price of drugs going to patients. This is not a system that functions for the benefit of the patients. It functions for the benefit of these middle people who've put themselves between the drug companies and the patients who need the drugs. One woman who was diagnosed with diabetes said her insurance no longer covered the glucose monitoring technology. It is now costing her $80 a month. That's about $1,000 a year for reference. So many of our residents need these drugs the most, are also most likely to be on fixed incomes. such as our older adult population. And that's where the price of drugs is really painful, because Social Security, does not keep pace with drug prices. And our system, as good as it may be, doesn't match the health systems in many other Western industrialized countries. So people really struggle, even with all the things they have, to pay for drugs. I know people personally who were prescribed drugs by a doctor and could not get their benefit provider to provide the drug that the doctor prescribes. So they had to take a secondary drug to the one that the doctor thought was the best medicine. Negotiated prices by Medicare on drugs won't take effect for another 3 years. So we're interested in providing as much pressure as we can now to help those who are struggling with these expenses. As noted yesterday to the audience in Leisure World, we need to continue to push for more aggressive legislation from the state assembly, as well as at the federal level. This is important work for all of us, I think, to be engaged in. In Maryland, our goal is to expand the authority of the board to cover everybody, not just state and local government employees. This coalition is trying to make this a top priority during the upcoming session, and I'm going to join them in their activism there. Putting curbs and regulations and excessive profits is not going to put these companies out of business. No one's talking about preventing companies from profiting. We've been in this battle too long. It's moving too slowly. Europeans pay a fraction of what Americans pay for the same drugs from the same manufacturers. So for low-income people, and as I said, limited fixed incomes, they never get increases in their wages and benefits that equal the inflation they're experiencing in the drugs. On the community health update, we have new COVID vaccines have started to arrive in our area, including our first shipment to our county's Department of Health and Human Services. Vaccines the county has received are going to be used to vaccinate uninsured adults. Our public health team will provide more information on the plan for reaching uninsured residents here. Unlike the first several rounds of vaccinations, local governments like ours will be getting limited supplies of the vaccine, and the vast majority are going to be earmarked for local pharmacies and retailers who offer vaccinations. And you can find out who offers these vaccinations at a website, vaccines.gov. As with previous vaccine rollouts, a full supply is not immediately available, so getting an appointment will take some patience. You should also check with your healthcare provider, as many are receiving the vaccine as well. But I want to reiterate, the number of vaccines the county is getting is small. So don't expect the county to have the kind of programs we were put in place last time, because our allocation is not the allocation we were getting previously. We were, for a long time, the primary providers of the vaccines. That's not going to be the case in this round and probably rounds going forward. Vaccines should be covered by your health insurance, but be sure to check on the specifics of your coverage. For example, such as companies like Kaiser Permanente require policyholders to get vaccinated at a Kaiser facility. So if you get vaccinated outside of a Kaiser facility, you may not get reimbursed for that. I also want to encourage everyone to take advantage of the returning government program in order to receive free COVID test kits through the mail. You can order those by visiting covid.gov/tests. We'll continue to provide test kits at libraries, but recommend you check with your library first, because we're seeing a lot of demand for the kits, and there are times when a specific branch will run out of them before we get resupplied. We continue to ask the Maryland Department of Health for more test kits, and we just put in a request yesterday for more kits than our typical order, and the state will be sending us more. As far as the week's case count, transmission levels, and hospitalizations are not much different from last weekend. We continue to be in low community transmission category. However, as this is the first week of fall, we've clearly seen over the last several years, as we transition to more indoor activities, the case rates may go up. So please get the new booster and an annual flu shot as well. If you're 60 and older or have a compromised immune system, it's recommended that you get the RSV vaccine. I'm going to turn this over now to our Public Health Emergency Preparedness Manager, Sean O'Donnell, who's going to go over this week's report. Thank you very much, and the show is yours, Sean.
Thank you, Mr. County Executive. Okay, to go through, first I just want to start with some information the CDC's shared with the state and local health departments. And this is a little bit generalized, but they gave a disease forecast for this fall. And while we don't know exactly how large the influenza season will be each year, it does vary year to year. They do expect both RSV and influenza levels that were extremely high last year to come down a bit this year. However, with the addition of COVID, that means our hospitals are going to be seeing more patients than they did back before we had COVID. So again, that we saw last year that first RSV, then flu, then COVID all created high volume at our hospitals. And you know, that volume prevents patients from getting in and being seen quickly when they stack up. And so that's why we emphasize how important it is to get your vaccinations for influenza and for COVID. And if you're over, I believe it is 60 for RSV. Looking at our surveillance from the past week or so, we've seen there's still COVID activity in their wastewater samples, although it's come down a little bit. That is corresponding with, as you can see here on the left, the PCR test results have been showing for about 12 days a gradual decline there. So it's a little optimistic that this wave that we've been going through for about a month and a half may be starting to turn. When we look at statewide and in our county in particular, test positivity, those have plateaued, in Montgomery County starting to come down just a little bit. And when we look at those transmission rates, you can see again, many of the counties are starting to see some declines in the transmission rates. We're hoping that this will continue on and come down. One of the concerns that the CDC raised is that we may have a milder, it's not a concern, they're hopeful that we'll have a milder COVID season this winter than previous seasons because of the increased immunity that our country has to COVID at this point, especially with a new vaccine out. One caution they mentioned was we may see COVID, the winter COVID season begin a little bit earlier this year because we've had a fairly mild summer so far. When we look at, again, our hospitalizations in Montgomery County, you can see that has leveled off over the last few weeks. When we look at our emergency department visits, these are people going to the ED, and when they get a discharge diagnosis, we aggregate that. You can see on the top, we've split it out by different age groups, and most of these age groups are starting to show a decline in emergency department visits with COVID. At the bottom left, you can see COVID for all ages, and in the middle, influenza, and on the right, RSV. You can see we're starting to see a little bit of activity for influenza and RSV. It's still at a much lower level, however, than COVID. And then again, just to reiterate what our county executive has said, there's lots of places where COVID testing can be found for free, in addition to our libraries through the mail. You can use the CDC's no-cost testing search engine to find pharmacies that offer no-cost testing. And of course, if you are symptomatic, you can go to one of the test to treat locators that if you have a positive test, they can potentially write you a prescription right there if you're in one of those higher risk groups. Again, vaccines.gov is showing a lot of locations across the county where you can make vaccine appointments. They show a lot of places where if you don't have insurance, you can go and be vaccinated at no cost to you. The one thing that it appears that vaccines.gov is not capturing is the private providers. A lot of private providers are not listing themselves publicly on the search engine. And so for parents who are trying to get their children vaccinated, we do suggest you call your pediatrician. If they don't offer it, see if they can have a recommendation to another provider who might have it. But again, as was mentioned, the vaccines are still rolling out. I think a lot of private providers are still waiting for their vaccines. We just got a little bit into the county on Monday. So we've already begun doing some vaccinations of uninsured residents. We're partnering up with our Montgomery Cares, the clinics that support Montgomery Cares, which is our services to provide health services to uninsured and underinsured residents. So we're partnering with them. We've been partnering with our community partners that serve as food distribution hubs that serve a lot of uninsured individuals. So we'll continue to do these and reach out through those networks to let our uninsured populations know that we're vaccinating. Those are the updates we have right now. I'd like to see if any of my colleagues, Dr. Bridgers or Dr. Davis, have anything to add. And if not, Dr. Stoddard.
Nothing from me in addition to what you presented, Mr. O'Donnell.
No, thank you, Mr. O'Donnell. I think you captured it all. I will one little caveat, give the pediatricians a break. We know that it's not necessarily in their offices yet. And it tends to be in the pharmacies before it's in the doctor's offices. So just be patient with your primary care. It's probably coming, but they may not have it yet. But we do encourage you to use your primary care folks to get your vaccines.
Dr. Stoddard?
Sounds like we're ready for Q&A.
All righty, we're ready for Q&A. Members of the media, please raise your hand if you have any questions regarding public health update and or general questions. No more questions? Going once, going twice. Well, thank you everybody for joining us this afternoon. Have a pleasant afternoon. Stay safe. We'll see you next time. Thank you, Mr. County Executive.